Welcome. Today we are tackling a topic that can feel confusing and overwhelming. Bioidentical hormones versus synthetic hormones. What's the difference? Which are safer and how do you choose the best one for you? If you're navigating menopause, perimenopause, or just looking to balance your hormones, you've probably heard conflicting opinions. Some people say that bioidentical hormones are a more natural, safer choice, while others insist that all hormone therapy carries risks. Today, we're going to cut through the confusion and we're going to review clear, evidence-based information so you can make an informed decision. By the end of this video, you're going to understand what bioidentical and non-bioidentical hormones are, the key differences, risks and benefits, how to determine what's right for you, and natural alternatives if HRT is not your path. Let's dive in. Before we compare bioidentical and non-bioidentical hormones, let's take a step back and talk about what hormones do for us. Hormones are your body's chemical messengers. They regulate almost every function in your body: metabolism, mood, sleep, libido. The three main hormones that we're going to talk about right now, but that affect menopause and perimenopause, are estrogen, supports your brain, your skin, your bones, regulates the cycle, and keeps your vaginal and bladder tissues healthy. Progesterone is progest. It's crucial for maintaining pregnancy. For our discussion in perimenopause and menopause, progesterone balances estrogen, supports sleep, and reduces anxiety. When our hormones start to decline, we experience symptoms: hot flashes, brain fog, mood swings, weight gain. And that's where hormone replenishment therapy, HRT, comes in. What are bioidentical hormones? Bioidentical simply means that the hormone has the same molecular structure as what your body used to make plenty of. Because of this, bioidentical hormones can be recognized and used by your body the same way as your own hormones. They're derived from natural sources like yams or soy, and they're processed to be chemically the same as human hormones. Bioidentical hormones can be FDA-approved prescription forms and also custom compounded, made by specialized pharmacies. Bioidentical hormones are designed to work exactly like the hormones that your body used to make, which brings us to what are synthetic hormones. I actually avoid the word synthetic. I prefer to say non-bioidentical. Non-bioidentical hormones are not structurally identical to human hormones. They imitate the effects of our hormones, but because the structure is different, they often behave differently in the body. Some common examples include non-bioidentical estrogen in oral contraceptive pills and older forms of HRT. Non-bioidentical progestins, also in birth control pills and some forms of HRT. Commonly known ones are Premarin, Provera, and of course the many types of birth control pills. What are the differences? Here are the key differences between bioidentical and non-bioidentical hormones. Here's what you need to know, and we're summarizing a little bit from what we talked about a moment ago. Bioidentical hormones, structurally identical to human hormones, considered by some to be more natural, available in many forms, can come as compounded versions that can be tailored to the individual, and they may have fewer side effects. A lot of research supports this. Non-bioidentical are chemically different from human hormones. They may have more side effects due to these differences. And some forms of non-bioidentical HRT can carry more risks. Sometimes adjusting the dosing and how you feel can be more difficult. One of the biggest concerns with non-bioidentical hormones was the trend towards more breast cancer in the Women's Health Initiative study. They were given an oral estrogen and a non-bioidentical progestin. The complications were due to those. Let's say a little more about risks and benefits, pluses and minuses of bioidentical or BHRT. Benefits: closely imitate human hormones. Topical estrogen has a lower incidence of stroke and other blood cardiovascular problems. Can be tailored to meet individual needs, often fewer side effects. Downside of bioidenticals might include that the compounding pharmacies are not FDA regulated, and you may have variability if the pharmacy doesn't send their products out for third-party testing, All the good ones do. Your doctor might not be versed in BHRT. Lots of insurances don't cover BHRT. Non-bioidentical. Pros. Because of how processes and drugs are approved by the FDA, there are many studies of them, and some of them can be bioidentical. They can be effective at managing symptoms. They're usually covered on insurance. They come in standardized dosing. Downside of non-bioidentical: if it's oral, higher incidence of blood clotting, possibly in a progestin, increased trend towards breast cancer, possibly more side effects, bloating, headaches, etc. So how do you decide what's right for you? Here are some questions to ask yourself and your doctor. What are my specific symptoms and goals? Personal or family history of blood clots, stroke, breast cancer. Do I want a more standardized treatment or more customized approach? What form of HRT fits my lifestyle best? Pills, patches, creams, injections. And lastly, does my doctor understand bioidentical hormones? There's no one size fits all. The best choice is what aligns with your health history, your lifestyle, and your comfort level. If you're not ready for hormone therapy or you can't take it for medical reasons, there are natural ways to support hormone balance. We talk a lot about that in other videos. Diet, whole, unprocessed foods, rich in healthy fats and fiber. Supplements can help with symptoms: black cohosh, maca root, magnesium, omegas. Exercise can help balance your hormones, and stress management and good sleep. These methods won't replace lost hormones, but they can definitely help alleviate symptoms and support your well-being. At the end of the day, this is about you, your health, your comfort, and your quality of life. Whether you choose bioidentical hormones, non-bioidentical hormones in some situations, or natural supplements, the key is making an informed decision that works for your body and your lifestyle. I hope this video helped clarify for you what we mean when we say bioidentical hormones. If it did, please share the video with a friend who might need this information. And remember, you deserve to feel good. If you are looking for more information or support or resources, connect with us at Dr. Liz MD. If you have not already, subscribe to my YouTube channel for more resources and updates. I welcome your questions and comments below. You can turn this phase, perimenopause and menopause, from a time in your life of frustration into a time of strength and empowerment. You don't have to just get through menopause. You can thrive. Take care and see you soon. Thanks for watching. I'm so excited that you want to feel your best so you can go out and do your best. Don't forget to like and share and subscribe and leave me a comment or a question. I will look forward to that. Talk with you soon.